Welcome and thank you for joining the NEHA National Webinar Series. This is the second installment of our four-part leadership series, The Hard Facts of Soft Skills. This session will be focusing on effective messaging for the environmental and public health professional. I'm Christy Denbrock, Chief Learning Officer at NEHA. Joining us today, and for the third time, is Alicia Love. Alicia is the Meat, Milk, and Egg Inspector Bureau Chief for the Montana Department of Livestock. Her expertise includes food safety and inspections with varied experience in retail and manufacturing. She earned her Bachelor of Science degree in Applied Biology from Arizona State University, and she holds a Master's of Public Health from Grand Canyon University. During her presentation, please feel free to write any questions you may have into the chat box, and we will address those at the end of her presentation. If you are not a NEHA member, we encourage you to join us, and we invite you to become one at neha.org. Alicia, I know we have a lot to cover, so why don't we just jump right into your presentation? And again, thank you for joining us.
Perfect. Thank you so much for the introduction, Christy. I'm very pleased to be back, and I hope that you enjoy this. In 2010, the United States Healthy People Objective identified health communication as a significant goal. This allocation highlighted the growing significance of public health's ability to communicate effectively with the industry and members of the public that it serves. Despite this goal, a poll done in 2022 found that 1/3 of Americans say they trusted public health information and news from the CDC either not much or not at all. As professionals in this realm, our focus is often to verify compliance, communicate regulatory findings, or even present information in a technical setting such as the one that you're sitting in right now. But we often don't stop to consider our ability to provide education to industries and the public in ways that help inspire them and help them feel empowered to support the mission of public health goals. In addition to the challenges that we face in being in a technical setting, interfacing with people who are not technically minded, we face other challenges as well. We oftentimes have these opportunities to educate the public without being prepared for the questions that we might receive or see these interactions as opportunities for growth. In public health, we have to be competent in so many different skills, and we often will talk about having so many different hats that we have to wear. So I want to break these down a little bit. Our first one is interpretation. It's our responsibility to look at industry practices, looking at laws, maybe evaluating scientific research, or attending continuing education seminars like this one. We also oftentimes are responsible for investigating our findings, and this can be in the form of reviewing records, having direct observations, or asking questions. And finally, we often have an enforcement component of the work that we do. And this could be in the form of a written report that you submit, having a meeting, or at rare occasions, taking further enforcement action. But what about these spaces in between? So between interpretation and investigation, we have to think critically. Are our findings consistent with what the law requires? Between investigation and enforcement, we have to make a decision on how to appropriately handle what we've learned. And then between interpretation and enforcement, there's an opportunity to educate. But what about that final piece in the middle there? As I stated a moment ago, we often have barriers to effective communication, and these can be kind of compiled into things like time constraints, misinformation, and technical speaking versus casual conversations. KFF Health News reported in September that many health departments nationwide experienced a boom and bust funding cycle in light of COVID. So, oftentimes, what we will see is a major public health crisis emerges, the public demands action, a lot of money gets thrown into whatever public health entity is responsible for managing it. And then, when the headlines die down, that funding is cut and leaves those health departments unsupported as they were before prior to the event occurring. This phenomena was kind of summarized by Brian Castrucci, the president and CEO of the De Beaumont Foundation, by saying, "You cannot hire the firefighters when the house is already burning." So this is a huge barrier that we face. In addition to having limited time, we are seeing misinformation spreading at a rate that's pretty unprecedented due to so many different social media sources out there and people taking a heightened interest in speaking their opinions about public health, whether it's educated or not, unfortunately. And then finally, a lot of us are given formal training or training through our education on how to present in a formal setting like this one here, but we don't often feel prepared to approach these casual conversations that really can spark change within our communities. So let's consider an environmental health specialist or a sanitarian in these various settings. These operational hours that are in this table here are just kind of a rough estimate that I put together, kind of based on just some business hours that I've seen online. But what I really want to drive at is when you look at the percentage on the right, we are spending a very, very small amount of time within these businesses that we regulate. Looking at a hotel, that might be an inspection that is done once a year. And they're operating 24 hours a day, oftentimes 365 days a year. So your time there is 0.03% of the time. So I challenge you to think about, how are you spending that time? Are you having enough time to really make an impact on that business owner or manager or custodian or whoever you're dealing with that day? How are you utilizing that time with them to really make an impact in health? Combating misinformation. I'm not going to spend a lot of time on this. This could be a presentation all by itself. But here's just a few very general tips for that. If you're within an organization that does have like a social media page, do not set and forget it. Don't allow your interface to become a place where misinformation can be spoken and there's no one there to correct what's being stated. There's a very interesting psychological phenomenon where if you are trying to correct misinformation, do not repeat the falsehood, because for some reason it actually seems to kind of solidify in people's brains, even if you're telling them it's wrong. So just very, very briefly say the statement that was said here is wrong and because, and spend more time talking about what the correct information is. And then lastly, be prepared that even when people receive correct information, it may not be sufficient to change their behavior or their decision-making process. So we have to do more than just educate. The one I always use for myself is, they say you shouldn't have screen time 2 hours before bed because it disrupts your circadian rhythm. Well, I believe the science, but it's not changing my behavior. All right. So we also face challenges when attempting to connect and persuade with individuals as opposed to being in a setting like this, right? When we are regulating, the conversation often has a negative association because we're there to identify issues and not look for success. Let's face it, when's the last time you were in the field and someone said, "Wow, I'm really happy you're here today," right? Additionally, technical speaking often means that we know what the conversation is going to be ahead of time. It allows us to frame the conversation and prepare ourselves for the questions or the subsequent conversations that are likely going to follow. Whereas if you're in an informal environment or you're doing an inspection, you don't know what you're going to find. You may not know what the business owner's concerns might be. And so you may not feel as prepared to embrace whatever dialogue you might be facing, right? And then finally, let's see if it'll advance. There we go. Finally, you are all here today because you have an interest in this topic. You are attending this presentation of your own free will, where when we're doing an inspection, we may be engaging with someone from the public that would maybe prefer not to have a conversation with us, maybe doesn't want to talk to us. And so it's very hard for us to have an engaging conversation with someone who is looking for a very quick exit to the interaction. All right, so this brings us back to creating a human connection. How do we connect to the people that we are responsible for regulating? How do we connect to our community when we're trying to advocate for laws and regulations that they might disagree with? We want to start with a strong foundation. Whether you're going somewhere to do an inspection or you're joining a community meeting, it's really important to clarify who you are and what organization you represent. If you're within an agency that verifies regulatory compliance, you might need to specify exactly what you're there to do. I come from the livestock world where we do meat inspection. If I go into one of my meat shops, I could be a meat inspector, I could be a sanitarian, I could be someone from weights and measures there to make sure that their scales are compliant. So it's really important to recognize that they might be seeing a lot of different people that have similar goals that may be coming through their doors. You also want to make sure that you note and keep any commitments that you make. If you tell someone that you're going to look into a matter, or if you tell someone you're going to return to the establishment, make sure you keep that. And I know that that's a very basic thing, but that's a really great way to build or destroy trust in a very small action. If for some reason you cannot meet the commitment that you've made, communicate it as soon as you're made aware of it. If you're still looking for something, say, hey, I know I said I was going to have this for you today. I'm waiting for more information. I'll let you know as soon as I know more. Don't leave them hanging. Oftentimes, folks, especially when we're on a regulatory stance, they feel like their time isn't considered valuable. And when we disregard deadlines that we make, it kind of reinforces that feeling. And then finally, be aware of cultural norms and expected body language that may not align with how your culture is. A really common example of this is kind of appropriate volumes of eye contact. Most cultures in the United States expect some amount of eye contact to occur, but there are certainly populations of people within the United States where making eye contact is actually considered very threatening language. So you want to just be mindful of that. And if for some reason, if you're picking up on some body language cues that indicates the other person's uncomfortable and you suspect that there might be a cultural difference, it may be worthwhile to do some research on it, reach out to some folks. If you have someone within your office that kind of assists with that, talk to them about it, because that may be preventing you from establishing good connections with people. Okay. Once your introductions are completed, you want to communicate how your findings will be shared. Or if you're having a meeting and there's a decision to be made, be transparent about how you're going to make that decision and how you're going to communicate it. Ideally, you want to have this exit meeting with them face to face or have a follow-up meeting when a decision is made. But if that's not possible, don't make them guess about it. Say, hey, I'm going to have this meeting in an hour and the decision will be made tomorrow. That decision will be communicated to you via email, or I will schedule a meeting with you tomorrow to discuss our findings. But make sure you're really clear about how they can expect to receive that information from you. You also want to make sure that you are answering those questions concisely. Make sure that if they are saying, hey, I don't really understand this, that you are building in time for them to feel like they can ask these things of you. If you are displaying that you're feeling rushed, if you're displaying that you don't intend to spend much time with them, they're going to pick up on that, and it's going to leave the interaction feeling like it's just kind of a one-side information dump, and they may not really understand what you're saying. I also encourage folks to connect before leaving. And this is especially true if you're in a role where you are doing an inspection. Even if you're not going to share the findings right at that moment for some reason, at least let them know that you're heading out. Say, hey, I'm done here. Thanks for your time. So that first, they do know that you've left. And second, if they do have questions, that you've given them the opportunity to interface with you. You also want to make sure that your communication is clear and that you clarify what you mean. Through this process, we tend, especially if you're a government regulator like I am, to use a lot of acronyms, and acronyms are extremely confusing, and so is technical language. So as an example, saying POV might mean point of view. It might mean privately owned vehicle. So occasionally we can pull some context clues out of what we're talking about. But if I were to give an example and said USDA FSIS policy of HACCP plans, I better be prepared to explain what that means, because a lot of people have no idea what on earth that stands for. That's just my little niche acronyms that I use at my job every day. The same thing can be said for jargon, right? So if I say that the sodium chloride ratio in my midday meal was higher than I prefer, you probably understand what that means, but it's probably easier just to say I don't like how much salt was in my lunch. So try to use simple language. Certainly you don't have to talk down to people. We shouldn't talk down to people. But if the goal is to be understood, don't add in extra barriers. And then the last point seems really basic, but recognize that keeping and establishing trust is vital. If you are unsure about something that you're talking about, just own that. Don't try to bluff it. Don't try to say, oh yeah, it's this, if you're not really sure. I think there is a lot of respect to be gained when I say, this is a complicated issue. I'm going to follow up with my supervisor, a colleague, a technical expert, and I'm going to follow up with you. Nothing really demolishes trust faster than lying, even if it isn't intended badly. But, mistakes happen. And if for some reason you were misinformed about something, take ownership of it the next time you see that person. Talk to them about it and say, the last time we met, I said this. I've since learned that we need to do this instead. Okay, so this brings us back to that connection piece. We've already kind of covered the first three, but this last piece is to inform and persuade. And most of our conversations are aimed to go that way, right? We want to educate people, and we want to kind of steer our conversations towards the outcome that we want, them following the law that we want, them complying with the regulation, them getting the vaccine for their kid that you think they should do. But I really want us to think about the impact that we are able to make. And so I would like to reframe this as the ability to empower and ignite people. Okay, so we've created this foundation. How do we take this one step further? How do we make the most of our time with whoever we're talking to? Oftentimes, our conversations may be neutral or even kind of a negative feeling. If you're a regulator, you might be out there talking about findings, talking about laws that were broken. And so that first interaction with that person might not have a positive feel to it. So if there's a way to redirect the conversation in a positive way, try to do that first. You want to make sure that there's a full understanding of whatever you're talking about. So you want to confirm that they understand what you're talking about. Don't assume that they understand everything you're saying. Again, you don't have to talk down to them, but Open up that opportunity for them to ask and not be judgmental about it. You want to make sure that you're actively listening through this process. They may be giving you some indications of what their barriers are to accomplishing what you need them to do. So active listening helps you identify, oh, they're saying they're short-staffed. They're saying that money is a problem with the business right now. And that may impact what solutions they're willing to accept. You want to aim for the desired outcome in the mindset of positive gains versus risk. Research has found that behavioral change is more likely to occur when the desired outcome is framed as a positive thing rather than undesirable outcomes result in fears or losses. So kind of that positive spin on how to get to the end of something versus this is the punishment, this is the consequence. That has shown in research to be less effective. Finally, if you're able to utilize storytelling of relatable situations combined with your data, it's found to be more engaging, and oftentimes people will be more receptive to what you're telling them. This approach has been utilized by FDA as evaluating individuals as oral or written cultures. So that's kind of a good study base of utilizing storytelling to assist. Okay, so let's just kind of put this in action for a moment. So I'm sure a lot of you have been told, no matter what I do, it's not good enough. Um, and while the frustration is understandable, our role in public health is often to find problems and discuss them, not ignore them. And we're not always there to just walk around and say, yep, this looks great and you're doing good and this is all wonderful. Often our role is not that positive. We're kind of trained and we exist to kind of find the problems, right? So let's try to frame it positive, as long as it's accurate. Don't lie about things. But if there's something positive that you can say to start the conversation, it kind of helps people feel more at ease and maybe be more receptive to talking about the problems. The question here can seem confrontational, but this is an opportunity for you to confirm what the regulation is and hopefully explain why a rule exists or why a rule changed. So when people are asking, hey, why can't I do this? Don't take it as an argument. Don't take it as, oh, this person's trying to be difficult. At its core, this person is trying to understand what you're saying and they want to know more about what it is. And maybe they are trying to challenge the authority, but if you can say, yeah, it says right here that you need to do it this way, then that gives them a good mindset of, okay, they're not lying to me. It is here. And it hopefully will open up more discussion to get more clarification if that's desired. All right, so here's that active listening piece. Turnover is a super common issue in a lot of industries that we deal with right now. And so, hearing that is helpful. If we know that turnover is a problem, then we can acknowledge it in what we say next. And then we want to talk about things in the term of positive gains. Putting signage out might actually help your staff. It might um, help remind them of what they need to do so you don't feel like you're constantly having to get after them all the time. Having a sign up can maybe help your staff encourage each other to do the right thing. Hey, the sign over there says do it this way. Let's do it that way. And again, that storytelling component can be helpful, especially if you can relate it to your own direct observations. That kind of helps folks feel reassured on, yeah, this is true. This is something that I'm seeing. A big thing that I like to do when I'm out in the field and I'm trying to help an establishment come up with some creative solutions to getting back into compliance is saying, you know, I saw another business go through what you're going through. Here's some things that they consider doing that might be successful for you. And that way, if they're feeling really lost, you're not telling them what to do. You're not telling them what the answer is, but you're helping them kind of reframe their problem with some really tangible solutions that have worked for their industry partners. And again, we want to make sure that when we're closing out our conversations, let's end it on a positive note. And especially if you're at a place where you may not see that person again for a long time, or maybe you're not sure that you will interact with them again in this setting, put out that olive branch and say, hey, I am available. Here's my card. Here's my contact information. Or if you're not the most appropriate person to help with any future concerns, this is where you can go if you still have questions. We don't want people to feel like they're kind of lost once you leave. When I used to do restaurant inspections, I would have restaurant owners and say, well, I can't ask you because if I want to do the wrong thing, I'll get in trouble. And I kind of would make a joke with them and I would say, well, if you call me on the phone and you say you want to do something, I can't write you for a violation unless you're actually doing it and I see it. So I said, if you want to call me up and say that you're going to start having an army of cockroaches tenderize your steaks for you, it's not a violation unless I see you really doing that. So you want to encourage that two-way dialogue. You want this to feel like an opportunity for them to get the right answers from the right place instead of kind of guessing at it until you come back and say it's wrong. I was once told by a leader in my organization that public health success is indicated by no news. The majority of the work that we do isn't noticed until it doesn't work. So we're not going to see a headline like this. Your water supply being safe, that's not going to hit the 5 o'clock news. People not getting sick from eating food at a festival, that doesn't make the news. It's when things go wrong that our world kind of hits the media. So it's hard at times for us to measure our success. But what we do know is that we are interfacing with the public and with these industries for such a limited amount of time that we really want to think about what our goals are when we interact with people. We want to think about, okay, I'm going to do this inspection. I'm going to find the problems. I'm going to write my report. But is there anything else that I can do while I'm here? If this establishment is constantly having problems with cooking temperatures, is there something that I can offer? Can I offer that our health department has posters? Can I encourage them to get additional training? Can I spend more time just answering questions there? Because really, the goal of a good public health organization is to prevent the bad things from happening. We want to see healthy communities. We want to see people successful. And when we're caught kind of in a system that only reacts to the bad, we've missed the opportunity to do good before the bad happens. Okay, so let's kind of test your knowledge and see what you think. And we'll just put these in the chat box. Okay, so I'm just going to leave this up for a moment so you can read it. And as you have some ideas, you can just pop them in the chat and I'll be kind of checking for that and we can discuss in just a moment. There we go. Yep, we want to avoid those acronyms. Anything else you see here that maybe could be improved? Let's check it out. Yes, perfect. Excellent. Yes, you all nailed this. Wonderful. So if you're in a meeting and there might be a lot of people in it, explain clearly who you are. Francis being empathetic, I love that. Let's see here. You guys are coming in fast now. Someone talked about the social stigmas. That's a good one. That's a really good example of some jargon that we're talking about that maybe isn't clearly understood by someone who has more of an educational background. Perfect. Knock this out of the park. Yes, talk about increasing MMR coverage instead of what is highlighted. Perfect. Wonderful. Okay, let's do another one. Yes, the exit interview is critical. Severe lack of communication with the manager. Yep. Explain why you're there to do the inspection and why it's important to them and the customers. Excellent. Not fooling anyone today. These midday presentations, everyone's got the caffeine going. I love it. Thank you so much. Yes, Larry, I love that. Asking if they want to accompany you as you find things. Perfect. Okay, let's see what else. Okay, starting to get some feedback here. Perfect. Okay, I think this pretty well aligns with what most of you are saying. So being empathetic about why they're concerned, certainly understandable that people would be worried about it. I think in this case, it's okay to share like, hey, I don't have that information yet. We are working to get it. And then encouraging them to follow up with however this information is being conveyed. Is it a website? Is there another community meeting that's scheduled where you can share the date? For some public health entities, they may not encourage you to get their information when you're in a non-work setting. But you can certainly give yours and say, hey, this is my work number. Yep. So these are all great points. I think all of you really understand. Yep. But I definitely would say for everyone that's saying like, yeah, let's direct them to PR, direct them to the website, definitely make that human connection first and help them understand like, this is what we have to do. This is where we need to go. I don't know where everyone's based out of, but here in the town that I live in, it is small. I don't work in water, but I've certainly had people stop me like at the farmer's market and say, hey, I have a question about this, and then I just say, well, let's get this to the appropriate time and place. Let me follow up with you on Monday. Let me follow up with you when I have resources available, so I can give you my full attention. Perfect. Oh, Julie, I love that. If there's a public posting, let me show you and find the information on your phone. Perfect. Yes. You guys are rock stars at this. Okay. Last scenario, and then we're going to get into some questions. Thinking it through. Keep looking over to the side here because that's where my chat box is. So I'm not trying to look away from everyone. Just trying to keep an eye on what your thoughts are. Okay. There you go. I like that idea. They could save money by not using so much chlorine. I like that idea. Spending more money on chlorine. Matthew, I like that framing. That's a really good way to do some positive framing on the situation. So acknowledging their role in the community. Okay. Discuss benefits to the community and investing to upkeep the pool. Yeah. All right, so what else do we have? Providing more education, for sure. And something that I always want to kind of remind folks, especially when I'm training my staff, is it isn't always possible to always just keep it in a positive frame. I always encourage people to start there if they're able to, if we can put it in a positive way first. But if that messaging isn't effective, it may need a shift in the conversation to say, if this continues, you might deal with people like having chemical burns in their lungs, and that would be really scary and really traumatizing for people. So I'm not saying in this presentation that you can't talk about the consequences of the situation. I just encourage people to think a little more critically before they start the conversation and see if you can just put a positive framing on it first. So I just want to throw that disclosure out there. Yep. I saw someone saying that they might look at the equipment or look at the manual to try to help them. I always caution people on that because if they do something that costs money or is a repair situation, if you happen to be wrong, there is some liability associated with that. So I just encourage you just to be careful when you're offering that to folks. Okay, storytelling. Nina and I are in the same community here, and so she probably remembers a pool that was in our circuit that had a similar issue and did end up having some concerns with it. So yeah, storytelling. This is a real thing that happens. This is something that could happen here. I didn't do a whole slide on it, but there is quite a bit of survivor bias that we kind of deal with where we say, well, my restaurant's never made anyone sick, or my pool's never hurt anyone, or no one's ever gotten bed bugs from my hotel. And we don't want to say that that's not true, but I oftentimes will use that comment as a way to say, hey, traceback is hard. I believe that you're trying to do things right. And I believe that, you are not trying to cause like a foodborne illness outbreak, but it is possible. It is possible that people can get sick from food, especially with whatever it is you're doing. And we just want to help you prevent that. Okay, perfect. Well, I talked a little faster than I did when I was practicing this, so we've got plenty of time for questions if you have any.
Thank you so much. Christy's power went out, so I will leave it
Oh, no.
open for questions. I know. Leave it open for questions for a little bit, and if not, we can wrap up early.
Okay, I'll keep an eye on the chat box
Me too.
here and see if anyone comes up with anything. I really appreciate everyone's engagement on the scenarios. That always helps expand learning so much. It's always good to see that everyone's out there listening.
Christy did say that you had some case studies you wanted to share.
Oh, I am not sure what she was referencing. I'm so sorry.
No, that's okay. Oh, she's probably talking about the questions that you did at the end.
Oh, maybe that's
what
it.
she's
That
talking
could
about.
be. Any tips for written guidance? Yes, actually. Um, so something that research has shown is that government agencies tend to be very, very text heavy. Government agencies really try to avoid that white space that might be on like a poster or a handout. And research in written communication has shown that that actually is not a great way to share information. Leaving more white space, maybe putting less text in, and kind of just trying to grab the highlights of what you're trying to say is going to give you better messaging. The other thing that you want to make sure you're doing is don't bury the headline. If your town is on a boil order, don't put at the top of it, water main break, this is who's impacted, and then the last sentence in your communication is residents are advised to boil all drinking and mouthwash water for this amount of time. Start with that. Boil order in effect for this area, for this time. And then at the bottom, put there was a water main break. This is what's going on. This is what kind of the expected fix is. So make sure you're not burying your headlines. That's a big one. And again, avoid your jargon, avoid those acronyms unless you're willing to spell them out. And something that I've gotten in the habit of doing is if I'm preparing a written message for the public or for my industry, I always like to find someone who isn't at my workplace, which sounds weird, but you know, ask a family friend, ask a neighbor, ask someone who doesn't work in your department, and say, read this and what do you think this means? What do you take away from this? Because if they don't live in the same kind of regulatory world that you're living in, they might say, Alicia, what is FSIS? And I'll say, oh, that means Food Safety Inspection Services. I'm missing an identification of an acronym here. So it's always great to have people within your organization proofread, but they're going to make some of the logical leaps that you are, and that can be a missed opportunity for clarifying your stance. Okay. So difficult operators, this one might go more into kind of conflict de-escalation. Conflict de-escalation is another presentation that I've done, and so I was really trying hard to keep my conflict de-escalation out of this one. But what I always encourage with people is if you're having a difficult operator and they're having those repeat violations, oftentimes it can come down to needing to have a sit-down conversation and saying, I recognize that this is your third cold holding violation. I recognize that employees are consistently not washing their hands well. What do you think is causing this? What is preventing your establishment from fixing this permanently? I also find that empathizing here can be helpful. And again, don't say this if you don't mean this. Don't say this if you won't say it sincerely. But with the establishments that I deal with, I say, I know you want to run a good business. I know that you have a good reputation in the community and you want to maintain that. Help me maintain that for you. Help me help you so that people don't get sick. I've straight up said, I know you don't want to hurt people with the food that you sell. I know you don't want to make your neighbor sick. I know that you don't want to do that. So those are some of the ways that you can kind of help align yourself as an ally to their cause and not be someone who's working against you. So those are kind of my overall tips for that one, Francis. Michael, apathy is a really hard one. It really is. And in my opinion, apathetic operators are even more difficult than angry operators. Angry operators are people to some extent that do care, even if it's going in the wrong direction. But apathy is really hard to untangle. And I know that a lot of jurisdictions have limited tools for compliance. So my best advice is I always encourage to try to find the thing that's kind of driving them. If you're dealing with someone and they say this is just a job and they don't care if the company gets in trouble, they don't care if they get closed down, you might have to find a different angle for it. And again, trying to kind of appeal to them as being a good person. Hey, I know you don't want to hurt people. I know you're just trying to do your job. But apathy is one that is still definitely a challenge, even for me. And Samantha says, communication team to review from various departments. That's a really smart idea. Okay. So how do you encourage the operator when they're far removed from the owner or person who spends the money? This is kind of a funny story that I have. I had a restaurant that had one of those little like ice cream bins, like the pre-packaged ice cream bins, and the manager hated it. It would like short out on power constantly, and then they'd have to waste product. And it was just a real annoyance for him. And so I went in one day, I did their inspection, they had a few findings, and the manager was like, Alicia, the manager won't buy us a new ice cream bin until this one creates a problem. He's like, is there anything you can do? And so I kind of looked it over and I said, well, the handle on it is kind of broken. And so I would call that spot not easily cleanable anymore. I said, if that was written as a violation, would that get his attention? And he said, yeah, I think I could sell that as like a really big deal. And then I could get a new machine to hold my ice creams. And the next time I came in, they had a new ice cream bin. So offer assistance when you can. In other cases where the person is maybe apathetic to the operation, you could certainly explore sending like a more formal letter instead of just the inspection report. Oftentimes if things come on letterhead from our main office, that tends to get the attention of the owner better. Again, I always want to aim for a more positive outlook on things, but if you're really struggling to get attention, say, hey, some of the possible consequences of what you're doing could include, not renewing your license or fines if you're in a district that has fines. So oftentimes, alluding to loss of business, alluding to loss of funding, those can be things that can kind of help get high level attention when needed. When the GM is the one that's apathetic, sometimes that too can be taking it to that higher level. Maybe there is like a corporate quality control person that does care and doesn't realize they have an apathetic GM. So something that my office is in the habit of doing these days is if we have repeat violations and my inspector says, I'm just not getting through to them, something that we will do is send like a letter and say, hey, on this date, this date, this date, and this date, you've had the same violation. Our discussions with your staff indicate that, but we do need to get this into compliance. And that can kind of separate from like, right, here's a written report to, whoa, I'm getting a letter. They're kind of calling out like these numerous issues that I've had. Like they're paying attention to what I'm doing. So again, not always a positive game framing, but sometimes that's what you need when apathy is kind of the prominent feeling about it. These are great. I appreciate all these questions.
There are a couple in the Q&A. There's some in the chat and then some in the Q&A. Do you want me to read those to you, or do you want to pop into the Q&A?
I can pop into them. Okay. Let's see here. So most of the time, repeat violators respond to citations. What do you think about it? So citations are hard because it depends on if you are within a department that has it. The department that I work for doesn't have a mechanism for distributing fines to licensed establishments. So the only way I can issue fines is for people who are operating without a license. What do I think about it? I think it kind of depends on what the issue is. If you have a business that's really struggling to stay afloat and they're communicating to you like, yes, I need to fix this freezer, but we're trying to save up money and I can't get a loan for it, adding a citation to it isn't going to help, right? They're already saying that money is the problem. And don't get me wrong. I mean, there's a cost of doing business, and I think all of us recognize that. But I think it really depends on kind of what's going on, whether or not citations are considered an effective tool. Another one that I see here, my district provides educational flyers. However, in a growing and ever-changing world, I just think more innovative approaches could work better. What educational materials do you use in your district that you find the most helpful? If I'm being really honest, public speaking events like this seem to be the most effective way for us to get out information. I routinely agree to speak at conferences for my industry, I'm attending one in a couple weeks here where it's an agricultural seminar, but they want me to be there to just answer questions. So being available and being able to build those one-on-one connections whenever possible seems to be the most effective thing for us. My office does send formal letters about like changing laws or, if we identify something that my office put out a long time ago that's no longer accurate, we publish letters to update that information. So really high level, like formal, like, hey, this law is changing. I try to keep formal, but then I pair it with, hey, you guys are having your annual conference. Can I have 20 minutes to talk about this change and answer any questions that you have? And that's a privilege of being in a state with a very low population and being in an industry that is very low population as well. So, I know most of my plant owners. I've met all of them. I've probably had conversations with them. And so the flow of information is definitely more multi-directional, and they're more likely to reach out to me because I've established that relationship with them. I recognize that in some areas where it's very high population, maybe the industry has a lot of turnover, you may not have the opportunity to build those relationships and kind of build that rapport with people. But that's something that I've found to be helpful. I find that social media that is run well is effective. I never remember the right acronym for it. Speaking of all those government acronyms that we have, that's like the CPSTC or something like that. But they do all of like the product recalls, and they have a Facebook page that is hilarious. They do the ridiculous memes. They kind of keep up with the meme trends. And I find that their messaging is entertaining. Thank you, Matthew. Yes, that's the one. But they keep up on it. It's entertaining. I'm not annoyed when they come through my Facebook feed. Like, I don't mind seeing what they're doing. And they do a great job of tying it into like, hey, fireworks are dangerous. So keep that in mind when you're playing with fireworks. Or, they do really, really good messaging. Something that they say is a big hindrance to government agencies using social media is a lot of, I won't say upper management, but a lot of the traditional thinking about messaging is like, we need to be professional, we need to be formal, we can't have like a cat with lightning bolts coming out of its eyes to tell people about like a new product that's shocking people. And so I think that creative approach is really helping grab people's attention in a positive way, as opposed to kind of the more what the public would construe as like stuffy, hey, here's a very formal letter and it's wordy and it's using technical language and like I'm bored reading this, right? So if the goal is to do kind of a widespread approach, having a social media team that has kind of a lot of grace to be creative and try to kind of find their audience in a way that captures their attention. So I hope that kind of answers your question there.
Alicia, I'm back. I apologize. The power of my home went out, so I
Oh no.
had to rejoin by my phone. And if you have one more question, we might have a few minutes to answer one more question.
I'm not seeing anything in chat.
Okay.
And I've got the two in our Q&A. So,
Wonderful. Okay, and thank you. And I would like to tell everyone to please, oops, I'm sorry, my phone, to please join us next Tuesday at the same time for the third installment of this leadership series, when we'll be talking about social and emotional intelligence, essential skills for managing yourself while working with others. We have a great 3-person panel for that. And again, that is next Tuesday as the third installment. So Alicia, again, thank you so much. I apologize for my power outage. As always, you're fabulous. And I would ask that everyone please take a few moments and fill out the short survey, because your feedback is instrumental in allowing us to bring you the topics that you need. And it also helps us to complete our mission, which is to build, sustain, and empower an effective environmental workforce. Again, Alicia, thank you. This is your third time speaking with us. I'm sure we'll be inviting you back again. And thank you everyone else for attending this webinar. And we will see you next Tuesday.
thank you.
Okay, thank you. Bye-bye.